this society where we are disconnected, where there's increased isolation, loneliness, and the belief really that human nature is competitive, aggressive, greedy, selfish. This is so abnormal compared to the majority of our species' existence. We see headlines about suicide rates, and every parent asks, whose fault is this? They want to say that this is because of social media. I wish it was that easy, Bob. If we could just take away social media and everything would be fixed, that would be great. It's so much more than that. To truly heal this generation, we need to focus on how can we make people feel more connected. We believe that if every single person has access to care when they need it most, it is possible to build a world where suicide does not exist.
I'm Bob Safian, and I'm here with Carter Barnhart, the founder and CEO of Charle Health, a fast-growing virtual treatment platform for mental health. Carter, thanks for joining us.
Bob, thank you so much for having me on.
So in just 4 years, Charle Health has gone from launch to 1,500 full-time employees, 40,000 patients. Your impetus was to focus on youth mental health to prevent suicides, although you've expanded to treat adults as well. There's been a lot of talk about the so-called loneliness epidemic, including from the U.S. Surgeon General. I don't know how to say this, but it's like you've been a beneficiary of that. Like, that's not the right word, but, how do you think about it, about this, the timing and the environment that you're working in?
I think a lot about this study that came out of Massachusetts that looked at 2,000 women over a 10-year period. And these were women that were all unhappily married. And the ones that didn't talk about their feelings were 4 times as likely to die as those that did talk about their feelings. And the only difference was that the women were talking and they were connected. And that's really where this all starts. When we talk about loneliness, certainly Charle Health has believed since the very beginning that a more connected world will help to fight and combat loneliness. The mental health system was already completely inadequate pre-COVID, but the cracks have just become even more apparent as demand has grown. And so, yes, Charle Health has in some ways been able to step in as that solution to bridge that gap and provide people access to evidence-based treatment that works. And really, I believe that my role as a connector is also to then just show people that there is hope and there's a way to combat this mental health crisis, which sometimes can just feel so hopeless.
Can you just give me a sentence or two of what Charle Health is?
Charle Health is a virtual mental health care provider that specializes in the high acuity population. That's people that are struggling with depression, anxiety, suicidal ideation, self-harm. And our clinicians provide intensive support for individuals who need more frequent care than just once a week outpatient therapy. And typically they're transitioning from an emergency, residential treatment, or maybe are in once a week therapy and need to step up to something higher.
You mentioned the term evidence-based. Charle Health calls itself like a solution to suicide prevention. What is the evidence-based treatment, and what makes Charle Health different than other kinds of treatments?
There's something called intensive outpatient programming, which has been around for decades and has just been greatly underutilized by the mental health care system. We figured out a way to deliver intensive treatment virtually. And when we first launched Charle Health, we were using evidence-based curriculums like CBT, DBT, but we didn't have the evidence to show that if you delivered that virtually, that it would be as effective. And so over the past 4.5 years, as we've grown, we have been data obsessed. And so using the data that we have to enhance our curriculum, to enhance the patient experience, allows us to have better outcomes year over year. We've been able to reduce the number of hospitalizations, which is really what we look at as success. Patients are coming to us in crisis, and we want to ensure that they don't end up back in crisis again. And so we follow them after discharge from our program to see if they end up in a higher level of care again, if they end up back at the emergency room. And we partner with both our patients as well as payers so that we can use claims data to really confirm the efficacy of our treatment model. 89% of our patients report improvements in self-harm. 95% of our patients report improvements in their symptoms associated with depression. 92% report improvements in their symptoms associated with anxiety. And then we're able, most importantly, to decrease that suicidal ideation.
I'm wondering if you can clarify for me, like, are expectations about mental health treatment being different than what works? You and I talked earlier, and you talked about rich kid rehabs versus like the power of group therapy. Can you explain what that difference is there?
So I spent the first 11 years of my career running residential treatment centers. Part of a residential experience is group therapy. And that group therapy, I saw how profound that was for individuals. And what I knew was when we created Charle Health that we needed to create an experience where people could hear me too. We pair clients together based on their condition, their age, the modality of treatment that they're going to benefit best from, as well as their lived experience, so that we can then put them into a group where they see people who look and sound like them. In that group, the curriculum that we deliver to them is based on all of the data that we have from previous clients who are similar to them. So we're able to constantly innovate on what that curriculum is to deliver the best possible group experience.
And so I guess the more your system grows, the better, in theory, right, that this treatment gets, because it gets more personalized without necessarily costing you more to deliver that more personalized treatment.
And that's what really excites me about Charle Health. Historically in behavioral health, as treatment programs have scaled, the quality has gotten worse. For us, because we're able to leverage technology to really improve care delivery, our treatment gets better.
You were motivated to found Charle Health in part because of traumatic experiences in your own life. If you're comfortable with it, can you share that story and say how it led you to work in mental health treatment?
When I was 14, I attended a concert with friends and was sexually assaulted at that concert. It was a terrible, life-altering experience. I went from this carefree, energetic, bold young woman into what felt like really a shell of myself. I started acting out, doing things that harmed myself, and I just really didn't want to live anymore. It all felt too painful. The next few years were some of the hardest of my life. Despite having access to numerous solutions and professionals and growing up in a loving, super supportive family, it took my family 2.5 years to find me the right treatment, which when you're 14 to 17, that feels like a lifetime, 2.5 years. And I had to travel across the country to receive the proper treatment. I went to this residential treatment center that was brand new in California. And it was there in that residential treatment center that I formed relationships and a community. I went from feeling lost, alone, hopeless to connected, inspired, safe. And after treatment, I went back to my high school, finished my senior year of high school, and then reached out to the founder of the treatment center and asked if I could come and intern for him. And he really served as a mentor for me for the next 11 years. I worked for him full time, growing this small residential treatment center into really what's known today as the gold standard in brick and mortar residential treatment. And there were so many days that I would be answering the phone late at night, talking to a hopeless parent on the other line, telling them that we didn't have availability or that the out-of-pocket expense was going to be unaffordable for them. And so I wanted to start something that was really rooted in access and delivered that same high-quality treatment experience to so many people who desperately, desperately need it.
For some folks who go into treatment like this, when they leave inpatient and they go back to, as you're talking about, your high school, or go back to their regular lives, it can often trigger them to just sort of slide back again. I mean, it sounds like part of what Charle Health also offers is a way to keep that support with you as you're re-engaging.
the transition back from a residential treatment center or a hospitalization is always challenging. You go from a safe environment where you're with people who understand you, where you're protected, to then back home and the realities of life. And that is one place where Charle Health can be extremely helpful, is that we help with that transition from a residential program back home. We provide that support virtually so that you don't feel alone. We see so often for our adolescents and young adults as they transition back into high school and college, that they feel like they're the only ones who have had this transformative experience. And that sometimes is even more isolating. And so giving them a community of people who they can come back to, who they can connect with in the evenings after school while they reintegrate is really powerful.
What do you think adults most misunderstand about the mental health of young people?
I think so often adults want to talk to me about social media. I see so many parents reaching out to me to say, what do I do about social media? Social media is causing this crisis. My kid is profoundly struggling because of Instagram, because of Snapchat. And I think that's certainly a piece of it. But it's so much more than that. We can't blame it just on social media. Our species, human beings, have been on this earth for, let's say, 200,000 years. And we lived in these small hunter-gatherer groups as communal creatures, where the children were with the parents the whole day, and the whole community acted as parents to the kids, where the interests were not individualistic and competitive, but instead really collaborative, communal, connected. And that's how we learned to survive. And we lived like that until about, 15,000 years ago, which in the context of 200,000 years is about 5 minutes. So we've been living like this for 5 minutes. And this society where we are disconnected, where there's increased isolation, loneliness, and the belief really that human nature is competitive, aggressive, greedy, selfish. This is so abnormal compared to the majority of our species' existence. We see headlines about suicide rates, and every parent asks, whose fault is this? And they want to point to one thing. They want to say that this is because of social media. But I really believe that that is just one piece of it. I believe that modern society has exacerbated this disconnection. And to truly heal this generation, we need to focus on how can we make people feel more connected? How can we foster genuine human connections for people who have experienced trauma? How can we help them heal from those emotional wounds and really reconnect with our authentic selves? And I think young people are actually starting to catch on to that. You'll see young people will have parties now where they'll say, leave the phones at the door. They're coming up with ways to prioritize connection with each other because they know they need that. And I think that is really the most misunderstood thing, is that there's not just one problem. It's not social media. I wish it was that easy, Bob. If we could just take away social media and everything would be fixed, that would be great. That's not it. It's so much more than that. We have to teach people to connect again, that we don't have to be this competitive society. We can all work together.
Are there ways to use the big digital platforms for meaningful connections, or is that just like a trap?
No, I think that there absolutely is. There's a way that we can leverage technology to assist with incredibly meaningful human connection. The goal should never be to replace face-to-face interactions. We had people living in rural communities during COVID who were so isolated, and we were able to use technology to bridge the gap for those who may have felt isolated in their struggles. And this sense of community and belonging helps to counteract that loneliness. And that loneliness often is perpetuated in online spaces. But if we can create safe spaces where, especially for people who are struggling with mental health, there's a clinician in the room helping to guide and facilitate and teach and show people that they're not alone, I really believe that all of this these social platforms can be so powerful. We just have to use them for good.
Just going on to TikTok and watching videos may not necessarily help me, though. It's the illusion of connection, right?
I don't think it's going to help you, Bob. I'm sorry. I think we need those live human connections.
There's been some talk about how some people can bond with a virtual companion, an AI, that sometimes like interactions for mental health could be better than with a human because, whatever, empathy is more programmed in or something. Do you think about AI as a tool in that way?
I don't think that there is a replacement for human interactions. I believe we need human interactions. AI can assist with those human interactions. One thing that we're doing, for example, is queuing for our clinicians. So we take all of their previous session notes, as well as the whole patient history. And during sessions, we're able to prompt our clinicians of, hey, maybe ask Bob about his kids. Maybe ask Bob about this, something that came up in maybe a group therapy session or a year ago when you were in treatment and we're reviewing your records. That prompting is so helpful. It's helpful for our clinician because they have many patients. They're dealing with complex cases. It's hard to remember everything. It's helpful for the patient because it makes them feel even more connected that I'm remembering something. But we still need that humanness.
You've grown so fast and so quickly. How has the rest of the mental health space responded? You said to me at one point, we keep waiting for competition.
When we founded Charle Health, I used to say that our biggest competition was the emergency room. And yes, I would say I would like someone else to compete with other than the emergency room. But the reason we say the emergency room is because that's where young people in crisis were going. And that still continues to be the number one place that people in crisis show up. And emergency rooms were designed for physical emergencies, not mental health emergencies. And there still is not another virtual provider at scale that focuses on this high acuity population.
And just so I understand, apps like, say, BetterHelp, where you can get emotional or mental health virtually, that's not for high acuity patients the same way, right?
We would categorize BetterHelp as a low acuity provider, similar to a Talkspace. We partner with low acuity providers like Talkiatry we've partnered with. They provide incredible access to psychiatry. Mantra, Lyra, all of these companies we partner with because they're helping us with the aftercare for our patients, or they're also identifying people who need to step up into care like Charle Health. So we have to partner with organizations like BetterHelp in order to successfully deliver care. And we're so grateful that we have those partners in communities.
I mean, it's interesting. It's like the rest of the healthcare system where sort of you kind of don't know where to go. You go from one specialist to the next. You're not really sure where to go next. There's no one sort of guiding your treatment overall.
And that's where care navigation is so important. And it's such an important part of what we do at Charle Health is really making patients feel taken care of through a case management function so that they can smoothly transition from one level of care to the next.
I'm curious too, there's so much angst over the political environment, the presidential election. Has that fueled trends in anxiety and mental health challenges? Is it too soon to see that?
So, certainly. I think that we see anytime after a debate, anytime you're having that trauma response, people are reaching out more and more for help. And so certainly in this incredibly tough political climate, we are seeing more people with anxiety, depression, and just overall hopelessness.
What's at stake then for the mental health of Americans in 2024?
I always like talking about the hope. So instead of what's at stake, we know that we are in a mental health crisis. The hope is that for the first time, we have solutions. We don't just have to look at what is happening and accept it. And that takes people partnering together. That takes payers working with the government, working with individuals, working with school systems, working with hospital systems. It takes collaboration, but there is hope. Treatment has been proven to work. And that is a message that I think everyone needs to hear and deserves to hear. I know what it felt like to be a hopeless teenager. And I wish someone had said to me, this will get better. If you receive the right form of treatment, you will feel better. And so it's now our job and our responsibility to really build this world. At Charle Health, we're building a world without suicide. We believe that if every single person has access to care when they need it most, it is possible to build a world where suicide does not exist.
For the business leaders who are listening in on this, your business has grown so fast. Are there key lessons that you've learned in scaling so quickly?
So many lessons. For me personally, I've had to learn that I really don't have to be for everyone. And honestly, I find that liberating. Since founding Charle Health, one of the most important lessons I've learned is that not every decision or approach will resonate with everyone. And that's perfectly okay. We went from 0 to 1,500 full-time employees in 4 years. And I saw, early on, I found myself trying to accommodate every perspective, every person, trying to be involved in every single detail, thinking that if I didn't, I wasn't leading effectively. But as we've grown and scaled, I've realized that trying to please everyone is a losing battle. It's counterproductive. It's not sustainable. And leadership is about staying aligned with your mission and your values, even when that means making decisions that won't be universally popular. And I think that's really allowed me to lead with more clarity and purpose, which in turn has made our organization stronger. I get asked all the time, how do you balance the heaviness of Charle Health? What we do is so emotionally draining. How do you recover? How do you show up? Things like that. And for me, what I found is the most important thing is just to have purpose. I am my happiest when I have purpose and when I'm solving a big problem or a small problem, but a concrete problem, that is when I experience joy. And so I have to stay true to myself there.
So you've had this great growth over this time period. So where does Charle Health go from here?
We're live in 37 states today. I would like to be live in all states. If I look 5 years out, my goal for Charle Health is really to be known as the standard for measurement-based care in the mental health space, with a tangible reduction in suicide rates across the country as proof of our impact. I hope that when we enter communities, people are able to say, because of Charle Health, the suicide rate has decreased.
Well, Carter, this has been great. Thank you so much for doing it.
Thank you so much, Bob. I really appreciate the time.